patients have a biopsy of their cancer or they have surgery for their cancer, the pathologist can look under the microscope and do a test for how much HER2 protein there is on each cell. That's called IHC test, or immunohistochemistry. And you get a score of 0 to 3 plus, so 0, 1 plus, 2 plus, 3 plus, where the 3 pluses are the cancers that are expressing a very high amount of HER2 protein. That's a HER2 positive cancer. Or we can actually count how many genes, how much of looking at the DNA of the cancer, how many genes of HER2 there are. That's called a FISH test or a KISH test. And if the number of HER2 genes in each cancer is above a certain level, that's also a way to identify these HER2 positive cancers. So typically we do either one or the other of these tests, and that identifies which cancers are HER2 positive. And while we can do subsequent biopsies, in general, because this is an alteration that happens pretty early in the development of the cancer, once a cancer is positive, it tends to stay positive. And we also don't see a lot of cancers go from negative to positive, although that happens in probably 8 or 10% of cancers. So in general, this is something that stays fairly stable over time. Once the realization was that these cancers are driven by this HER2 protein, that's led to the development of a number of different drugs that all target this HER2 protein. In fact, we have 8 that are approved right now in the clinic, and we tend to use almost all of them at some time or another. We start out with that 3-drug combination of a chemotherapy plus these 2 antibodies, trastuzumab and pertuzumab, and that's highly effective. Most patients' cancer shrinks substantially with that combination, and we continue that for a certain amount of time, depending on how well they're working and how many side effects they're having. Typically something like 6 or 8 cycles of therapy, somewhere around 4 to 6 months of therapy, but that can vary. But then once we feel like we've had maximal benefit from the 3 drugs with the chemotherapy, we typically actually stop the chemotherapy, and patients can just continue on those 2 very targeted drugs, the pertuzumab and trastuzumab, without chemotherapy. And that combination we call maintenance treatment can be very effective for many, many months or years in patients. And if a cancer develops resistance to that, which certainly can occur over time, we then switch to a second approach, and this is a different way of attacking HER2. It's the same general idea of using an antibody targeting HER2 with a chemotherapy, but this is a new approach where we actually combine the 2 drugs together. So there's something called an antibody drug conjugate, which is basically the HER2 antibody, which is what's very specific for HER2, and it's linked to the chemotherapy directly, so that rather than give 2 drugs separately, you're giving this one combination drug. It's a way to kind of specifically deliver the potent chemotherapy right to the cancer cell, with the hope that because the chemotherapy is attached to the antibody and not just floating around by itself, it won't damage normal tissues as much as when you give chemotherapy alone. The one that we typically use in this situation is called trastuzumab deruxtecan, also known as Enhertu, and that's been shown to be very effective, probably the most potent drug against HER2-positive breast cancer that we have right now, and that's used in patients whose cancer has progressed on that combination of antibodies and chemotherapy that we use first. And when used in that what we call second-line situation, the effectiveness has been on average well over 2 years, and it works in most patients. Eventually, though, cancers can develop resistance to trastuzumab deruxtecan, and at that point, we have a number of other options available. There's another antibody drug conjugate called TDM1, which is also effective and has very few side effects. There's also a whole nother approach to targeting HER2, which is what's called a kinase inhibitor. It's a pill that actually blocks the HER2 function on the inside of the cell, and also can be very effective. And there's the one that's typically used is called tucatinib, and it's used in combination with trastuzumab and an oral chemotherapy called capecitabine. and that's also shown to be effective. And we have a number of other combinations available as well. So between those 8 drugs that I mentioned targeting HER2, we have a number of different options that we can use for patients with this particular subtype of breast cancer.
To learn more about the 8 FDA-approved treatments for HER2-positive breast cancer, you can check out our video linked in the description.